Hi there, I'm Jennifer with Sublimely Aligned, and today we're going to rotate. We're going to rotate lying down. I do have a video sitting up if you're interested. The goal with rotation is to maintain trunk health, the yield of the muscles around the trunk. It supports sort of optimal processes contained within your trunk. But the other element of this is that we often get injured in rotation. And it's not because we're not meant to rotate. It's because I think we don't rotate. That would be my guess. But clinically or sort of anecdotally speaking, in terms of what I've seen over 24 years, is that I notice as we age or people age, they just simply don't rotate that much. So it's really healthy to think about rotation and to ensure that you're integrating it into the context of whatever your movement program is. So for rotation, I do recommend that you get your rib cage into neutral passively. You can definitely rotate without the rib cage in neutral, but you'll be doing more of a spine twist, so there's nothing wrong with that. But for this, we're trying to focus on the front of the abdomen. And I'm going to be using the arc barrel and this softer head pillow, but you can use towels, pillows, whatever you have around the house. And the goal is to get the rib cage passively in neutral relative to the pelvis. So when I come down, the way I test that is I make sure that my shoulders are propped high enough and my head is propped high enough that my ribs just sort of disappear into the flesh of my abdomen. Then I have a bolster here. I don't think it's going to be adequate for what we're doing, but it's for my legs. So you're going to lie down and you're going to scoot your pelvis one way. So I'm scooting it over. In this case, it happens to be left, and I'm going to straighten out my right leg as my bottom leg. And then I'm going to bring my bolster. I'm going to lift up my leg, and I'm going to try and maintain my rib cage heavy onto my bolstered shoulder bolster, I guess. And I'm going to rotate my pelvis until I can't go any further without lifting my rib cage. So I've already lifted my rib cage, which means ideally to bolster my knee. If you see, if I let it drop down, my bolster supports it, but I probably need a couple bolsters here to be able to just relax and hang out here. And I do recommend you do spend a bit of time hanging out here because you want to breathe into this position. Notice whether that breath and the breathing helps to release any tension anywhere. And I've already lifted my ribcage a little. I don't know that it has to be perfect. The goal is really just for you to explore how much you rotate on this side relative to the other side, so make sure you go ahead and do that. If you maintain your leg up and you don't have a bolster, you'll find a lot of abductor work, so down the side of the leg, the lateral hip. And again, I'm not so sure that that's conducive to what we're trying to do here, which is passively allow those tissues to yield with just the work of or a little bit of aid from gravity. So make sure you do your other side when you do this. Again, you're going for maintaining the rib cage onto whatever shoulder bolster platform you have, but it doesn't have to be perfect. There shouldn't be any pain. There should only be sort of a nice sense of blood flow through the trunk. So give it a try and let me know how it went.